is correct. It's not when the time you are born. In fact, you age when the sperm and ovum comes together. That's where you start aging. That is the correct definition. So unfortunately, the book I keep. I asked this similar. So next time if you attend a talk elsewhere, so if you attended Forever Living, sure correct one. So please don't put out your hand. I'll recognize all your face. Okay. Now let me bring you through. We are all born with a nice, clean blood vessels like that. This is what we call the endothelium, inner lining of blood vessels. You can see the lumen is the whitish part. But if we do not protect our blood vessels, there's injuries to the inner lining. Then it started having what we call the damage. The fat will start to leak out. Over time, you'll get thicker and thicker. Can you see this bluish thing down here? These are the calciums in the wall of the blood vessels. Okay? So your blood vessels become harder. When this lumen get more and more narrow, more than how many percent? 70%. Very good. Then you started having what? Symptoms. You know why I want to teach you 70%? No? Very important. Next time you go and see a doctor, they say, hey, you have this 50% block. Okay, I want to put a stent for you. Do you want to let him do it? No, better don't do it. You understand? So don't do it. Don't let the doctor cheat your money. See, I give you all. So must be more than 70% block before it's worthwhile doing. You see the reason, because if it's not more than 70% block, you do it, more dangerous. Do you understand what I mean or not? All right. My kiasu, Singaporean kiasu syndrome, do one, get one free. No, don't do that. Sometimes my patients are like that one. They have. When we do bypass operation for them, I say, okay, anyway, these are all the blockages here. You have 90% block in LAD, 75% block in circumflex. Your RCA, right coronary artery, is only 50% block. So I did 2 bypasses for you. Doctor, why don't you do the third one also? Do it. I say, if I do it, it's giving you a disservice. You understand or not? So my time sin is that. So don't say. So knowledge is very important. Now, see, this is the plaque. And when it's covered by a very thick cap, what does it mean? Who doesn't have pimples besides the small little girl running around? So every one of us has pimples, right? When the pimples is not right, you squeeze very hard to burst. But when the pimples is ripened, even you touch, you burst, right? So this is what we call the plaque. Similarly, you can associate the plaque inside the blood vessel is like pimples. When it's not ripe, it's very stable. The only thing that happens is that when there's not enough blood supply, when you exert yourself, you cause some pain. Otherwise, it's quite stable. But this is the scary part. When the pimple is ripened, this thing can burst. When it bursts, then it can start initiating the whole series of reactions, causing the blood vessels to block off completely. In other words, your blood vessels can convert from 50% block to 100% block within a very short time. I'm sure that you heard story before. So-and-so went to see doctor for a heart checkup. And then when he did so-called the CT coronary angiogram, 50% block, right? So it's correct. The doctor said no need to do anything. Next moment, drop dead, right? It's because the plaque ruptures. So more important thing is not only the percentage blockages, it's how unstable are the symptoms. Do you understand what I'm trying to say? If you have chest pain in the presence of blockages, you have to be very careful because you might be having this thing going on. So if I can give you something to prevent you from having a heart attack, that I'll save your life. So this is what happened. When you cut the vessels open, this is what we call clots, blocking the blood vessels. And this pale looking color here is a heart that is devoid of the blood supply. Now, I was reading a very interesting book. After this, I'm going to share with you also. Nowadays, you know that the amount of money we spend on healthcare, we're talking about America, is enormous amount of money. Okay, we also are heading the same direction. And now we spend a lot of money on treatment. Okay, if you have cancer, you know the cancer drug eraser. 1 month, eraser, 1 month, 十幾千. And how much money are you going to spend on this? I think it's enormous amount of money. What is more important, every time when we face with a disease, we ask ourselves, what are the root causes? For example, you come and see me, you say that I have chest pain. Okay, we say, oh, he has chest pain. What system is involved? Probably the cardiovascular system, something to do with the heart. And in the heart itself, which part of the heart is involved? Probably the blood vessels. And from there, we stop. We don't inquire anymore, right? Because that is what we do. But to be a good doctor, you shouldn't stop here. We should ask, in the first place, what happened to your muscle cells? What happened to the cells in the blood vessels? Why are they damaged? Causing all your subsequent problems. In us, we must have a reverse thinking. You understand what I mean? To address the underlying cause, the root cause of it. Not to look at the effect. Effect is very easy. Is to look at it. So when you come and see me, I'll put this chart in front of me. I say, you count how many daggers you have. 你有几把刀？这个不是最新的哈，最新的有17把刀，不是小李飞刀哈。So sometimes looking at the blood test result, I'll just count how many. The more knives, the more daggers you have, the more risk you have. We have to do something to exclude. Okay. This is a very, very important information now. What causes the blockages of the heart vessels? We know that now the blood vessels blockages, so-called atherosclerosis, is the result of inflammation. Inflammation means that your blood vessels inside is inflamed. As a result of that, it initiates the whole series of response. I remember when I was a general surgeon way back in about 20 years ago. Every night we do something. We do a scope for people who come in with bleeding ulcers. They come in and pass out blood stools. Then we put a scope in, right? They take out whether there's any ulcer or not. That time, every night we do at least 5, 6, 7 scopes. Since then, 1980. This guy found that actually ulcers is related to this bacteria called Helicobacter pylori. It's not because of acid damaging the lining of the stomach, no? So stupid Western doctor only give antacids, H2 blocker. It doesn't solve the underlying problem. Then when they start, there's an association between the bacteria and the ulcers. So from there, when you have stomach pain now, ulcer, they'll check whether you have this bacteria. If you have bacteria, they give you what? Antibiotics, right? So ever since antibiotics is used for perforated ulcer or ulcer disease, now stomach doctor 没工做了. You understand what I mean or not? So that is the important part of it. You have to find out what's wrong with the particular conditions. Similarly, if I tell you now the heart blockages, atherosclerosis is related to this, very soon why? Because you all live forever already. Okay, inflammation. So bear in mind, it's result of inflammation. Now I want to bring you to deeper level now. What is the main, who is the main culprit causing the vessels inflammation? Is this thing called LDL. LDL is a bad cholesterol. What happens when the bad cholesterol, the level is a lot, traveling inside the blood vessels, they get oxidized. Once they get oxidized, this oxidized LDL is the main culprit. First of all, it will damage the inner lining of blood vessels. It can secrete these adhesion molecules to kind of pull this, what we call white blood cells through the gaps in the endothelium. And you know white blood cells is meant to fight what? Bacterial infection, right? It's not meant to clear out what? The lipids are, these fats, right? But in order for the white blood cells to perform this, it changed the gene expression. So they become what we call, they gobble up the fats, and they become this, what we call foam cells. And when they form cells, what happens when the bubble cells grow bigger? It bursts. So by doing so, it releases all the enzymes So it damaged the surrounding smooth muscle here. And this process go on and on, on and on and on. That's the reason why you started having this so-called plaque building up. So in other words, in order to prevent heart disease, you have to do what? You have to lower the level of LDL. Not only that, you have to prevent this from oxidizing. So later on, we'll talk about that. All right? So I mentioned earlier on, abnormal lipids is the most important risk factors among all of them. Okay? If you have abnormal lipids, your heart attack risk is increased to 3.25%. So this is the level of the LDL and the risk of heart disease. You can see that if your LDL level increases this way, your risk increases. Okay? So I have patients last week who came to see me. The LDL is 165. Okay? One of them came to see me 2 weeks ago. The level is 189. LDL, not total, no? Total is about 400 over. Okay, if you already have heart blockages or you already have stenting done, your LDL level you should keep even lower, much lower. Because below 100 is not good enough. Actually, you should keep it around 50 to 70 so that your residual risk is much lower, right? Now, every time you go and do health screening, this week I have this AMOR, go for pre-employment screening. So because you're abnormal treadmill, came to see me. Then I say, how is your blood cholesterol, blood lipid? He said, the doctor said good. I said, which doctor? Screening doctor. He said, good. I said, how good is it? I don't know. Total is good. Total is about 202. Don't be happy with total. In fact, total is the one that I'm least interested. I'm more interested in LDL cholesterol, HDL cholesterol, and TG. You want your LDL cholesterol to be as low as possible. You want the HDL to be as high as possible. You want your TG to be as low as possible. So when I asked him about when I asked him about his cholesterol, he said, my total is 202. He doesn't know about LDL. He doesn't know about the HDL. He doesn't know about TG. So I say, when he came back to see me, I look at the result. Yes, correct. The LDL is what? The LDL is 140. The HDL is only 39. The TG, which is usually, TG by the way is not cholesterol. TG is 240. So you can see that when people tell you it's okay, it's not okay, all right? So if better is possible, good is not enough. So you have to really to bring it down. And I know that all of you are very worried about this one. Me too. Me too. I hate medicine. Okay. So, but there are many things you can do to lower your cholesterol. This is what we call lifestyle, diet change, exercise, etc. What is important? In fact, a lot of people who come and see me, the medicine, they eat less and less. It can start with very high dose. One patient came and see me. His Lipitor is taking 40. And his GP wants to increase another medicine to control his cholesterol. Then because his friend said, you better go and see Dr. Tan. Dr. Tan has some fa bao. So how to bring it down. So after he see me for 1 year plus, now his cholesterol medicine is only 5 mg, from 40 to 5. And the reason why I need to keep 5 mg is because statins is useful to stabilize his plaque, because he also have coronary artery disease. So, but I will tell you later on more things about that. So very important thing, high cholesterol is not only taking medicine. You need to do other things. And this is a very important slide. I'm sure a lot of people here, at least 40% of us are here sitting down here, irrespective of age, sex, we have high cholesterol. Right? Be honest, put out our hands. Yeah, sure have one. I 不要姓陈. You know why? Because I've done so many health screening before in the community. This is what we found. About 40% of Singaporeans have abnormal blood lipids. All right? Now this is a take-home message. 1 month ago, I have one patient whom I did 3 bypasses for him about 7 months ago. He sent me a card. He sent me a card. Hey, Dr. Tan, thank you very much for all your advice and all that. I have been living my life according to your advice now. Now I want to report to you because I saw my cardiologist. He checked all the blood. All the numbers are tip-top. Thank you very much. Your method does work. You see? So there's a lot of people who give me all this. The one that I'm going to share with you is my past 15 years experience. What works, what doesn't work. No point telling you something doesn't work. You want to lower cholesterol, right? Eat grass. 假草的吼. I say how to 假草? No, cannot. This one doesn't work one. So I better teach you something works. And it is doable. That's more important. First of all, from the diet standpoint, you have to do something. But before we go on to diet, I want to give you some knowledge. 85% of the LDL cholesterol and the TG is made by your own liver. Okay? So in other words, the cholesterol is made by your own body. So coconut has no cholesterol, is correct. Because why? Coconut tree has no liver. So when you read those who are no cholesterol, wow, very happy. But it didn't tell you a lot of saturated fat. Right or not? Because why no cholesterol? Coconut has no liver. So only animal source can have cholesterol because they have liver. So that's the whole message. So 85% of the cholesterol is actually made by your own liver. Now, the next question is asked, where it get the source from? The source comes from saturated fat and what we call the excess sugar. Excess sugar, it can produce TG, and TG can convert to LDL. That's how it works. I think Singaporean, we don't eat a lot of internal organs. You talk to Chinese physician, 假脑补脑假瓜补瓜吃肾补肾 that one I do not know Anyway, we know that we don't eat a lot of internal organs, right? We don't, right? Eggs is something that is controversial. A lot of times people say, should I eat egg or should I not eat egg? But if your cholesterol is very high, for example, LDL is very high, then you don't eat egg yolk. You eat plenty of egg white. It's okay. Egg yolk maybe once a week is fine. For normal people, what you can eat, 1 week, 2, 3 egg yolk is okay. Because that is not the main source. The main source is here. What you made in your own liver, from where? Your beef steak, your mutton, and or your butter, and your creams, and all those things are processed food. I want auntie very cute. Hey, Dr. Tan, I never eat all this one, no. I don't like beef. I don't like mutton. I don't like pork. I say, what do you eat? Eat fish, oh? You say, eat fish, chicken. I say, very good. What else? Chicken, no? Very good. Got skin, no? No skin. Very good. Say, what else do you eat? I eat bread, no? Say, what do you put on the bread? I put butter, no? My butter, not very thin one. It's like akun roti, very thick one. Say, how many do you eat? I eat 4 slices, 4 slices. I say, that's where you have all the LDL cholesterol. You understand? So not necessarily you must only, you must only eat red meats. These are the source of saturated fat. So, and the next thing you have to bear in mind, in order to reduce your LDL cholesterol, you have to reduce the bile acid from recycling. You see, bile salts is manufactured in the liver. It helps us to absorb the fat. But once it reabsorbs back, it breaks down into cholesterol. It will raise your blood cholesterol. So in other words, in order to reduce your cholesterol, you need to do 3 things from diet standpoint. First of all, you cut down on or rather don't eat the internal organs. You can eat plenty of egg yolk, wrong, egg white, but no egg yolk. But you really have to manage this part, which is the processed food, which are all the oil, the palm oil, the fried stuff and all that. That's where it gives you the saturated fat and excess sugar. And next thing, I encourage you all to change the way you eat your breakfast. Not mee rebus, mee siam, or mee pota, hei mee teng, hei mee ta for breakfast. Breakfast, who eats at home? Put out a hand. Breakfast is not 1 cup of Milo. I know. I've been living through throughout my years, when, bosikan, 1 cup of Milo, good enough. No. Breakfast, you eat at home. Breakfast, what you need to do, you eat raw oatmeals. Those raw oat, 老人卖煮的, not instant one. Then you put egg white in it. Can put 3 egg whites in it. Then no creamer, no sugar. Then you eat with what? You eat those nuts. Sometimes you use those healthy nuts, the almonds, all those things, or walnuts, or those healthy snacks. Or you eat with bananas, not durian. So you eat that, wow, I tell you, very yummy, yummy. That 1 glass of what? I drink 1 glass of soya milk, unsweetened. If you can buy organic, better still. Now very cheap. So that is my breakfast. Breakfast, eat how much? Eat a lot. Especially if you want to lose weight. Okay? So this is how I eat my breakfast. All right? So because the oats, the soluble fiber, it binds the bile salt. It reduces the recycling. Okay? So that needs to take. Now, another short few things about the medicine. As I told you, Dr. Tan hates medicine. That's why drug company never sponsor me for overseas treatment. Because Dr. Tan order 如酒. How come your medicine, people increase one, you reduce one? I say, my patient don't need to take so much medicine. So good? I say, yeah. But the results still very good. So tell me more. Okay. I say, attend my class next time. In terms of medicine, very important, you have to know this. There are many different types of medicines to lower the cholesterol in the market. Recently, I think you read in the newspaper, simvastatin is what we call Zocor. 80 milligrams is associated with higher risk of liver injuries. The medicine you use have different potency. You can see that this is simvastatin, the one that is mentioned in the newspaper. 80 milligrams, it can lower the LDL cholesterol by about 43%. But if your cholesterol LDL is very high, I like to use this drug called Crestor. Can you see that? 10 milligrams, it reduces the LDL by 45%. In other words, the lower the dosage, the less the damage to the body. Do you understand what I mean or not? So it's not so much of, wow, 如嘴如后, medicine is 如嘴如不后. The more you have, the more the injury. Okay, so take home message for number 1 culprit, the blood cholesterol, especially the LDL cholesterol, you really have to reduce it. I encourage you all through lifestyle change. If your risk profile is very bad, then sometimes interim period of starting some medicine to bring it down is important. Next, smoking. I think smoking is not a main issue down here. A lot of Singaporeans, besides the younger men now, they smoke a lot. Old men, like people like us, not sorry, wrong, I'm still young. We don't smoke, okay? So smoking increase the risk, okay? All right. Now, let's talk about diabetes, okay? Actually, we know that if your blood sugar is more than 7, you probably are diabetic. But now we are more interested in the group whereby they are what we call pre-diabetic. Pre-diabetic. What is pre-diabetic? Akang datang. Ai lai liao, akang datang. Those akang datang group, we are more concerned. So you see, serially when they do the blood test and all that, you say, hey, my sugar is getting from initially 5.8, next year 6, next year 6.5, next year 6.7, and you notice their weight is this year 60, next year 62, the following year 65, 70, and the waist circumference also getting this way, and the sugar go this way. Do you understand what I mean? This is what we call metabolic syndrome. Actually, Singapore very scared of diabetic. Singapore, everything must be number 1, right? Airport all number 1, port number 1. Now Singapore also number 1. Higher incidence of diabetes in the whole world. Scary, So be careful of that. How do I keep my blood sugar under control? That's what is more important you all need to know. In fact, all these things we all know. Keep within the normal weight range. Watch what you eat. Eat food with low glycemic index, meaning all the non-processed food. So when you eat fruits, I have one very interesting patient say, I told you to eat a lot of fruits and vegetables. Dr. Tan, I ate a lot of fruits every day, a lot. I say, how much? A lot. I say, how do you eat it? I juice it, lor. I juice 20 apples a day. I drink the apple juice. I say, what happened to the apple? Throw away, lor. No, you have to eat the whole apple. You eat 20 apples a day. Whole apple. Everything must eat whole. All right? So that is how you eat fruits. So do not eat only the juice of it. All right? So low glycemic index food. Cut out on refined sugar. Don't put sugar if you can. Natural sweetness is best. Cut out on fatty food, regular exercise. I think this one, grandmother's story, everybody knows. But this chart, I want you to see. Can you look for yourself? What are the things that you like? Instead of orange, you drink orange juice. All these are potatoes, bread, white bread. All those have what? Sugar in it. Pancake, wow, yummy, yummy. So waffles are yummy, yummy. Coke, is it? Zero Coke, Diet Coke, or whatever. So these are the top 20 carbohydrates that we consume. Now, next thing is high blood pressure. All right. Normal blood pressure should be 130, 80 and below. Treatment of high blood pressure is an art rather than a science. Because why? Because for high blood pressure, I tell you one thing. If you have heart blockages, sometimes it's dangerous to bring your blood pressure too low because it can cause heart attack. All right? So be careful about this thing called J-curve phenomenon. So sometimes too low also no good for patients with pre-existing heart disease. How to control blood pressure, to lower blood pressure? 7 steps. Okay, not taking medicine. You have to take your medicine. You have to regularly monitor your blood pressure. You have to stop smoking. You have to exercise, lose your weight, exercise regularly, and do some what we call relaxation therapy and all that. So these are the things that I make my patient do. I think years back, I have one 75-year-old lady. He has a family history of hypertension. He came to see me with a pressure about 180. Over 90. So over 6 months period, I say, in addition to taking my medicine, I want you to do the rest of the 6 steps. So she did it. She's very, very faithful. She did it. 6 months later, her pressure go back to normal. She cut down on her salt intake, do all the things. Now he's free of medicine. She's not taking any medicine. Okay? So it's important. You can do that. Abdominal obesity. Why we are worried about metabolic syndrome? You see, we are having an epidemic. Why are we growing fatter? It's because we overeat. Now we know that fat causes a lot of, obesity causes a lot of problems here, from the head to the toe. You name it, you have it. And women always ask me one question, No, Doc, last time when I got married, I only 40 kilos, I married for 20 years. Now I'm 60 kilos. Why? I say very easy. You married 20 years, right? 1 year you put on 1 kilo. 20 years, how many? 20 kilos, you see? That's why you become this to that, lor. So very easy to put on weight. Actually, putting on weight is very easy. To lose weight is very difficult. Obesity, we all know, it shortens life. You never see a person who lives beyond 100 years old very fat one. Have you seen? Never. So what type of obesity you are worried is the type that is all in your tummy. So some people want to go for what? Liposuction. 挑不多油啊 especially those 愛曉嘅嗬，不多挑到你邊邊啦嗬。But 不多油是無料啦。Tummy fat no but inside all the liver, all the intestine fat is still there. You see, still white. So no use Don't cheat yourself So what you want is to lose the thing This is my nightmare. When I was in America, Cleveland Clinic, we operated on 180 kilo man for heart problem. You know how big is his heart? The size of his fist. Can you imagine this size heart can help to supply the rest of the fat? You must be joking. All right, so please, how to achieve a lifelong healthy weight? Actually, weight itself is not just a shape. It's also the composition. It's not just the body composition, not BMI, not waist circumference, but important thing is optimal body functions. In us, you have to optimize all the body functions. Okay, when we talk about strategies, if I were to conduct slimming courses, like London weight management, don't know what, Mary France, a lot of things. There's so many things. Anyway, one of the things that you have to bear in mind, whatever strategy must be convenient, affordable, simple, safe, efficacious, and doable for entire life. Not London weight, only do it for 3 months and later on you go sideways again. Why? Because certain therapy only lasts for a few months. So that is why did this so-called magic bullet weight loss efforts ultimately fail? Because they don't go into the root causes. All right. So there are so many reasons for obesity, and there are so many environment factors, genetic factors, and all these things affect. I have no time to go into that. I just give you a teaser, what you can do. So you see, there's a nice strategies to get you up to the ideal weight. You can see there are many things you can do to restore your hormonal sensitivities, all these things, and sometimes with the use of certain medicine to help you, green tea, supplements, all these things, to help you to get back your system in order. Like all things in life, this is my idol. Einstein, my idol. Because he's also losing more hair. This one is, I always like him because he has one picture with less hair. Einstein says what? We should always keep things as simple as possible, not one bit simpler. You want to tell people to do something, you have to tell them very simple, cannot tell them very difficult. You know the healthy lifestyle thing, when the health promotion will show you those food pyramid. Have you seen the healthy food pyramid? Yes? Should lah. This one very difficult to understand. Nobody understands. In fact, United States Department of Agriculture has done one thing good over the last 30 years. Is last year when it came out with this thing called Dietary Guideline for Americans, 2010. This is what they say, my plate. They want Americans, all the Americans' family to do this. Before you eat, put in the mouth, you look at your plate, what is the composition of your plate? Okay? From there on, you know whether you are eating healthily or not. I go into in detail. This is my Singapore plate. No point talking about American plates. The Singapore plate, you can fruits and vegetables. Now, the Singaporeans don't eat salad. They say salad 排酱, steamed vegetables. This one very very nice. Those the fruit salads. You see, not a juice. So you eat all these things before your main meals, about 15 minutes. From there, the green parts. See, the fruits and vegetables must occupy half of the plate. Okay, got it? Then next, this quarter here is grain. So for grains, see, no white rice. Take brown rice or chobi, or if you cannot eat rice, I like to eat this one, sweet potato. Sweet potato is very good, but sometimes my patient complain after sweet potato, they fart a lot. 放屁嘛. I say don't worry, you get the whole family to eat. So each one they have a harmony, boom 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 boom. So when everybody do it, become a norm. Okay, that's my advice to you. So buy more sweet potatoes and eat it. And very good, sweet potato, I tell you, it's very good. Or you can eat sweet corn. One of my patients, I have one patient, his TG is, you guess how much TG? His triglycerides is 600 over. He has been seeing doctor over the past 40 over years. He actually came because he brought his boss, Vietnamese boss, come and see me. Then he said, hey, Dr. Tan, can I see you also? I said, for what? I also have a problem. So his TG is 600 over. His LDL not too bad. But TG is 600 over, LDL is not accurate because we cannot assess the LDL level. So what happened? So I said, you want to do it, right? I said, yes. Okay. You do exactly what I tell you. So he did exactly what I told him. I didn't change his medicine at all because his medicine all max already. Cannot. He followed my eating style. Okay, 3 months later, you know his TG went down to how much? You guess. You guess? 180. Yeah. From 600 to 180. You see, you just have a knowledge. I say, you do this thing, he does it every day. So from that day onwards, he say, I don't have rice anymore. I eat hangzi every day. I say, good for you. Okay, that's why he eats. He substitute his rice with 汤匙. All right. So anyway, so for the protein part is steamed fish, grilled fish, or chicken, tofu. And this is my favorite. Really, if you come to my house when we eat a dinner, this is what is standard on the table. This is what we eat. Do you understand what I mean? So once in a while you pamper yourself, it's okay. No? Like Christmas, you go and eat a steak. No, we won't die one. Okay? Don't say, Christmas also don't eat steak. I might做人的后啦. Life sometimes not worth living if you are becoming like a saint. You understand what I mean? Our patient will complain like that. No, Dr. Tan, you see, you teach my wife so much. My wife very strict, controls 366 days. Cannot eat. Char kway teow also cannot eat. Wow, then 真逼切咧. Life not worth living. I say, wow. Then I say next time you bring your wife here, I counsel your wife. I say he can eat it on Christmas Day.